Hello everyone, and welcome to this crucial guide on how you could survive a stroke if you're alone. A stroke is a sudden interruption in blood supply to our brain, and it requires immediate action. And knowing what you can do will truly save your life. So let's explore detailed steps to take in this critical situation. So let's first delve into what a stroke actually is. Your brain relies on a constant supply of oxygen-rich blood to function. And this blood flow brings essential nutrients and oxygen to your brain cells and removes waste products. When a stroke occurs, this blood supply is cut off. It causes the brain cells to begin dying within minutes. And strokes are broadly categorized into two types: ischemic and hemorrhagic. Ischemic strokes are the majority of strokes that we'll see, about 87% of all strokes. And it's caused by a blockage in the artery, often from a blood clot. And hemorrhagic strokes result from bleeding, either from a burst blood vessel or an aneurysm in the brain. And this bleeding can increase pressure within the skull and damage our brain tissue. Both types of strokes lead to rapid loss of brain functions controlled by the affected areas, which is why quick recognition and response are crucial. So let's break down the F.A.S.T acronym, F-A.S.T. First, F is for face drooping. Look in a mirror or use your phone's front camera to check your face. Smile or show your teeth. If one side droops, this could be a sign of a stroke. Touch your face to see if it's numb. Next, A for arm weakness. Try to raise both arms at the same time. Count to 5 out loud. And while keeping them elevated, if one arm falls or cannot be lifted, this indicates weakness or numbness. Then S for speech difficulty. Repeat a simple sentence, such as, "The sky is blue today." If your words are slurred or difficult to understand, or if you cannot repeat the sentence, this is a warning sign. And finally, T for time, to call for help. Every second counts. Time lost is brain function lost. Use your phone's assistant or emergency features if you cannot dial the number manually. Now let's cover the immediate steps you should take. God forbid this ever happens to you. First, stay calm and focused. Take a deep breath. We know that stress exacerbates these symptoms, so focus on the next steps instead of dwelling on fear. Second, call emergency services. Use voice activation features on your phone if you cannot use your hands well. Clearly mention stroke and your location. Third, prepare your environment. If possible, unlock the door to allow responders to give them that quick access so they can come in. Fourth, position yourself safely. Lie on your side with a pillow under your head to keep it slightly elevated. Avoid eating or drinking anything to prevent choking. Fifth, communicate your symptoms. If you can, write them down. Use a voice recorder, whatever it is. You need to communicate your symptoms and the time that they started. This information is critical for your medical team. And leverage technology where possible. Use smart home devices like Alexa or Google Assistant to notify a friend or a family member. Consider setting up an emergency app that can send out SOS messages to your location, to your pre-designed contacts at a push of a button. And once help arrives, clearly and slowly explain what happened and any pre-existing conditions or medications you're taking. This will aid them in providing the best care quickly. And it's important that for recovery and prevention, follow any medical instructions post-treatment diligently. This may include physical therapy, changing your diet, your medication. You want to engage in regular exercise. You want to eat a heart-healthy diet and manage your risk factors like high blood pressure, diabetes, or whatever it may be to reduce the chance of future strokes. So in summary, understanding what happens during a stroke and recognizing these symptoms using this mnemonic, F.A.S.T, can make all the difference in responding effectively. Quick action can preserve your health and quality of life. Please share this information with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandell.